So what is a mental disorder? In mental health legislation definitions, a mental disorder is really defined as any disease or disability of the mind. A specific diagnosis is not mandatory, only a finding of some mental disorder. And I think this is an important thing to remember because, again, mental disorder, when you think about that definition, is in fact a very broad term that encompasses a very wide number of behaviors and symptoms and signs. One of the things I think, particularly in an emergency room setting, that we struggle with is the whole concept of intoxication as a mental disorder. And I think particularly when physicians assess somebody in the emergency room and are considering a Form 1 with possible transfer to a Schedule 1 facility for further assessment, there can get to be a little bit of discussion as to whether or not intoxication, first of all, merits putting somebody on a Form 1, and then how do you actually manage that in terms of letting somebody sleep off a period of intoxication and what that might do to influence your thoughts about whether or not they meet Form 1 criteria. So the first thing to remember about intoxication is that it is in fact listed in diagnostic manuals for mental illness. It's listed both in DSM-4 and as well in ICD-10, which are the most commonly used diagnostic manuals for mental illness. And the example that I can give is for DSM-4, it's listed very specifically with a clear definition, which includes recent ingestion of alcohol. There's evidence of clinically significant maladaptive behavior and psychological changes. The person needs to have evidence of one of a whole bunch of typical physical signs and symptoms of intoxication. You need to turn your mind to whether or not the presentation is possibly due to a general medical condition or not better accounted for by another mental disorder. So it has a very clear definition and is listed clearly under DSM-4. The other thing to take into consideration is that when we look at the whole issue of substance use and substance-related disorders, even though intoxication at the time of presentation might look like the most important thing there, 50% of people who have a mental illness will have a co-occurring substance-related disorder, and how much intoxication versus a possible underlying mental illness influences that person's behavior and why they are actually on a Form 1 has to be taken into consideration. And given that 1 in 2 people likely have an underlying mental illness, really suggests that we need to take intoxication seriously and ensure when somebody's on a Form 1 that consideration is given to the underlying mental disorder once the intoxication settles. So just going back to the issue of a Form 1, a few other criteria that we need to be clear of in terms of definitions from a mental health legislation perspective. A Form 1 indicates that the physician is of the opinion that the person is apparently suffering from mental disorder that likely will result in. The reason to just focus on that sentence is that, again, by putting someone on a Form 1, it's quite a broad definition. By saying that there is a likelihood, what that implies is that the physician does not need to be certain that a mental disorder is present in order to put somebody through a period of 72 hours of assessment. It needs to be likely, and likely from a legal definition means probable, not highly probable, but probable. So again, that's the bar that Form 1s are set around, and it helps us establish balancing risk with the need to ensure that we're assessing people that should be assessed from a psychiatric perspective. Now, Form 1s, as you know, are divided into Box A and Box B criteria. And just to quickly review the Box A criteria, as we know, they are serious bodily harm to self or to another, or serious physical impairment of the person. And again, from a legal perspective, what do these words mean on a Form 1? Serious bodily harm really implies that the physician, in addition to feeling there's a likelihood of mental disorder, feels that there is potentially a risk of suicide or risk of intentional actions of self-harm, which is serious in the sense of self-mutilation or by severing digits or burning one's own body. So what that means is that if there is a suggestion of risk of suicide, or if it's not suicide, there is a concern about self-harm. These are the kinds of levels of severity around self-harm which we're often thinking about for a Form 1. With respect to harm to others, again, a physician, as they turn their mind to evidence of mental disorder and a concern about harm to others, the legal definition is the concept of bodily harm that is not merely trifling. So it's not putting somebody on a Form 1 under that second criteria because they have shoved somebody. You might do that if in their past history a shove quickly leads to a punch or an assault with a knife. That would be a different thing. But bodily harm, like one episode of shoving somebody, may not necessarily mean that they meet that criteria. So harm to others includes considering the current action that you're concerned about, also considering a little bit about past history and other risk factors around the risk that you're taking into consideration. Finally, the third criteria for a Form 1 is the serious physical impairment criteria. And again, when you think about what does serious physical impairment mean, and you're looking at a bar or threshold that as a physician you're trying to figure out, does that meet that or not? Examples of that might be a concern about unintentional self-harm through an inability to care for oneself. So in our cold weather, which we're having right now, somebody who has a likelihood of mental disorder and is going outside with bare feet or no coat and hat and gloves, you would be concerned about frostbite, and that would be an example of meeting risk of serious physical impairment. People who have other kinds of illnesses who may act out in ways that cause themselves harm indirectly, such as sexually provocative behavior in a manic patient, which might put them at risk for sexual exploitation by somebody else. That's something that you would consider in terms of serious physical impairment to the person in a Form 1 situation. So in addition to the Box A criteria, which are quite clear and laid out, there is also Box B criteria that can be met. Box B criteria are a little bit trickier in that there are 5 specific issues that have to be met in order for somebody to be certified on Box B criteria. So a physician who wishes to use Box B criteria must have a history of ongoing mental disorder in the person they wish to put on a Form 1 on Box B. That physician also needs to know that clinical improvement can occur as a result of treatment. They need to know that the person is incapable to consent to treatment. They need to assess that person and determine that that person at the time of putting them on the Form 1 Box B criteria is suffering from the same mental disorder as elucidated in point 1 of that list, and that they must consider that harm, deterioration, or impairment is likely if the person is not certified at that time. So sometimes people consider Box B criteria as being a bit softer in terms of having to just demonstrate that there's a possibility of deterioration. But when you actually go through the list of all the Box B criteria and are fully aware that you need to have a clear history of the person, knowledge of prior improvement on treatment, know that they are incapable to consent to treatment, and have assessed them to be suffering from the same mental disorder, Box B criteria actually get a bit trickier in terms of certifying people, and it's not something that you would often see from an emergency room setting in terms of putting somebody on a Form 1. In an emergency room, people tend to use predominantly Box A criteria during the assessment. Other thing just to keep in mind when we're thinking about the Form 1 and using it, Form 1 has to be completed along with a Form 42. In Ontario, the Form 42 is a form that identifies that the patient has been notified that they are on a Form 1, and it clearly states the reasons why the person is on the Form 1, and it also outlines that the person has a right to contact a lawyer for assistance. If there is no evidence of a Form 42, then a Form 1 is in fact invalid. So it's a really important part of the process and important to remember to do in terms of that whole chain of events to ensure that the person is being detained legally and that the requirements of the Mental Health Act are being followed. As we know, the duration of a Form 1 is 72 hours. Just to remind everyone that the clock on that 72 hours starts running when the person is brought to the healthcare facility where the assessment will be done. So that is at the time when the person is brought to the Schedule 1 facility, the clock starts ticking at that point, because that's where these psychiatric assessment under the application form from a Form 1 is done.